If you are a health professional in South Africa in private practice and you are getting ready to open your doors to face-to-face therapy, you might be a bit worried and concerned about how can you protect yourself and your patients and get your practice COVID-19 ready. Well, in today's episode, I'm going to be chatting with Donne Nel from Care with COVID, who helps health professionals and the average businessman with exactly this problem. So if you'd like to know what you need to put in place and how you can effectively get your private practice COVID-19 ready, then stay tuned. And if you're new here, my name is Tasneem Abrahams. Welcome to my channel. I share tips and tools for health professionals who want to start and grow a profitable private practice in South Africa. If you like this kind of content, don't forget to hit the subscribe button as well as the notification bell to be notified when I upload new videos. Let's get into it. Guest today. Her name is Donne Nel, and she is an occupational therapist from the University of Cape Town, and she has joined 3 other health professionals in starting a small consulting business called Care with COVID, and it's aimed at helping small businesses, especially small private health practices, to reopen and run their businesses safely and with peace of mind during COVID-19 pandemic. So welcome, Donne, and thank you so much for joining me.
Thank you so much, Tasneem. It's wonderful to be having these discussions during this uncertain time.
Yeah, no, it is. And I think why I invited you to come on is because it's great, first of all, to see that this initiative is coming from somebody who is a health professional themselves and not from outside, because you have a unique understanding of what problems or anxieties a health professional might have, and particularly in the allied health, because it's very difficult for us to deliver our services without hands-on, especially if you're in peds practice and so on. So let's start there by you first telling us a little bit about who you are and who the other therapists or professionals are that you've joined and why you created this business.
So I'm an occupational therapist and I'm working in private practice. I work in a hospital environment and I also see outpatients. And I'm working in a practice where we share space with another group of health professionals. And I really found that we were having quite similar conversations around how do we manage this COVID pandemic? How do we still assist our patients and still continue to do some form of hands-on treatment in this uncertain time? And when we started having the discussion, myself and 3 colleagues, another occupational therapist actually, and 2 physiotherapists, really identified that developing a protocol that is in line with government regulations and also is really minimizing risk of virus transmission is crucial and is also really tough. We found we had the shared experience of being really bombarded with so much information. I think our professional bodies have been amazing in providing us with guidance, but we all felt really, really overwhelmed by the amount of information out there and trying to really make sense of it. So we came up with the idea, as 4 health professionals in all working in private practice in slightly different fields of private practice, we thought we would really like to be able to help our colleagues in trying to make sense of it all. So that's really where Care with COVID came together. And it's been quite a journey. We've obviously had to keep really up to date with legislation and the changing levels and really think out of the box in terms of different healthcare providers having different needs. But we're really hoping to reach people and to make this time a little bit less challenging and a little bit easier to manage in terms of getting back to work and getting back to practicing.
So, yeah, I think that's fantastic, and that you took that initiative. And so following on that, what would you say would be your top tips, your top generic tips that all practices could use to get back safely and to meet those regulations?
Yeah. So I think the number one thing is that we do need to be making sure that we are following the legislation. We do need to be making sure that we are following government guidelines and keeping abreast of what's happening there. And at this time, there's a huge amount of preparation that actually goes into seeing a client face to face. We need to be making sure we make contact with that specific person before their appointment to screen, to check, have they been in contact with any COVID positive people, or have they been presenting with any symptoms, ideally before they even arrive at our practice. And this is obviously quite different to how we've had to operate before. So I think one of the first pieces of advice is make sure that the patients who are coming to see you have been screened, are not high-risk clients, in the sense that we've got to be looking at their comorbidities, we've got to be looking at their age and establishing, is the benefit of them coming to see you face-to-face more than the risk of them coming to see you face-to-face? Can this consultation actually be done via telehealth? We have to be asking ourselves these questions so that we can give clear guidelines and clear reasoning for why we encourage the client to come and see us for an in-person consultation. So that's really the pre-appointment side of things, where before we even have the client come to see us. And then making sure that we have a very thorough COVID-specific consent form. And actually that's something that we have generated as Care with COVID. So it is part of the protocol guidelines that we provide. And making sure that we've covered all our bases in terms of educating the client or the patient on the potential risk of coming to see you in your practice. And the other tips are basic sort of ideas of, what are you going to do when your client arrives 10 minutes early for their appointment? Are they going to be in the waiting room, or are you going to ask them to stay in their car? Will they be removing their shoes, or will they be sanitizing the soles of their shoes? How do we document who comes in and out of the practice? So if we do have a COVID positive case, we know that we need to make contact with people who've potentially been exposed. So the main tips I would say is that you've got to be getting adequate consent from your client, and then thinking about sort of in-house factors, sanitizing, making sure that you're disposing of your waste correctly, ensuring that your client and yourself are wearing masks, other PPE, aprons sometimes, and gloves might be indicated for hands-on treatment. So there is a lot to think about, and I think that's where we really thought, actually we need something that's user-friendly, that puts this information into a summarized format where we can say, great, I can actually apply this in my practice. And I think it also gives our clients the sense of security in knowing that we've got all our paperwork up to date, we've put in our protocols, and the confidence for them to be able to come to see us.
Yes, absolutely. I think a big part of, I think we focus so much on the doing, like, the getting the hand sanitizer and like all of these things in place. But I think that is quite a big piece that we need to not overlook, which is that if you portray sort of a sense of readiness and confidence, and then it puts your patients' minds at ease. Absolutely. And so they're more likely to embrace sort of the changes that you've implemented. Whereas if you are anxious and worried and about whether you've done everything correctly, and then it puts them in a position of feeling anxious, and because they feed off of you. I mean, we know this as therapists. Our patients, our clients, they feed off of our energies and our rapport with them. So absolutely, I think that is, it's kind of also just giving your patients that peace of mind that you are ready for them, that you've done the work, and you've done so professionally, you know. Now, it says, you say there that Care with COVID offers guidelines and on customizable protocols, government regulation and documents and PPE recommendations. And get your COVID care plan. So what does that mean? What would the process be? What is it that what is the service that you actually provide? What can people expect when they come to your website?
Okay. So I've actually printed out the protocol guidelines and the workplace plan, just to give a bit of an idea of what they actually look like. The purpose of placing all of this on the website, and you'll also see, Tasneem, that there's a list of resources on one of our other tabs, and it's really about making information very accessible and very user friendly. So the COVID protocol guidelines comes out like this. It's a PDF document, and you fill in specific information about your practice. So it's specific to your practice. And we have laid this out while referring to a number of documents that have been provided both by government and professional bodies in terms of how to follow correct protocols in this COVID-19 pandemic. So here we've got, I don't know if you can see very clearly, but we have literally listed the things that you need to do when you book your appointment with your client, to the day before the appointment, what needs to happen on the day. So again, just bullet points on how do you open your practice, how do you get your room ready for your session, and what are the things we need to be considering in terms of making sure that the client has also been educated on what has to happen. So when the client arrives, taking temperature, filling out the screening form, again, trying to make it as user-friendly as possible. During the treatment session and after the treatment session, how to sanitize. We've also included a little bit of information about when you actually go home, what should we be doing to protect ourselves and our family?
Yeah, I think that's a critical one, eh?
As well, yeah. And we've added in some advice on environmental considerations. Obviously, the OT's got quite involved with this, because I think there are a number of things that we can do in terms of environmentally to reduce risk of transmission. And also tips on how to manage a shared practice, because I found that, you know, through our discussions, we really identified that different health professionals have different approaches. And when we're working in shared spaces, we all need to be on the same page, so to speak. So this is part of the COVID care plan. It's the customizable protocol guidelines. And the cost of this is 450 Rand. So you receive this document, but you also receive a COVID-specific consent form. You get a screening form for clients to complete as they arrive. It also includes a pre-appointment letter for your client to advise them of the protocol that the practice follows, and a PPE checklist for you to be able to identify what PPE you need in your practice and whether you've covered all your bases. We also include a document that has been taken from the government regulations on what to do if a client arrives with COVID symptoms, or what to do when their temperature is above the recommended amount, or if a colleague or a client tests positive, how to handle that situation and who to inform. We've also something that's available freely already, but we've included just for the sake of convenience, the client permit to travel and staff permit to travel as well. So that is all included in the 450 Rand protocol. And the idea is to really just make it user friendly. So you've got this document that gives you very clear guidelines about how to go from opening your practice and booking your appointment to closing at the end of the day and going home, and all the kind of documentation that you need related to that.
Can I just say, I mean, I think that is a really worthwhile investment, because, I mean, if you think, I've just started back I work at a school, and I've just gone back today, But as part of the SBST and as the OT at the school, we weren't sitting at home doing nothing. We've been working this entire time, drawing up these protocols. My job was to type up the protocol for the scholastic department, in class, out of class, going to break, and like step by step. Like it's so time consuming, because I also had to then go and research all the regulations and all that. If I think the amount of time I took to put that together and get approval from the principal and all of this, and if you consider as a private practice, let's say you have an hour session with the patient and you charge, let's say, 750, for example, for that session, like, and you spend maybe 5 hours trying to just research all of these documents. If you think what your hourly rate is to see a patient compared, then 450 is nothing to spend once off and know that you have everything on a template. You can customize it to your own needs, put your own logo, all of that stuff in. I think it's fantastic. It's such a time saver, and at least you know that you've got everything covered.
So the other part of the COVID care plan is what we call the workplace plan. And this is specifically a document that has been highlighted as necessary by government. So technically, we should all have a workplace plan in our practice. And what government have indicated is that we need to actually identify a designated COVID compliance officer. We need to have, and obviously as a sole practitioner, it's us, so to speak. Yeah. Especially when we employ people, we need to identify one person who is responsible for checking on PPE, for making sure that the guidelines are in line with regulations and as things change. So this workplace plan is, again, customizable. You enter your own information on the front page, and it really is a checklist. It gives you sort of an idea of how are you rotating staff, how are you reintroducing staff if you've got more than one person working within your practice. What are the staff demographics? So do we have any employees who are potentially at risk with comorbid conditions? We need to include this information. What to do when you enter and exit your practice, how are you screening your patients? And then also information on social distancing. So this is also quite helpful because it gives us a couple of ideas and points as to how to actually implement social distancing within our workplace setting. And then keeping an attendance register and looking at what facilities you've got within your practice. Have you got a shared kitchen? Have you got a shared bathroom? What are the protocols there around minimizing infection risk? And again, we've tried to make it really user-friendly. So using pictures, using infographics, this can be something that you can have displayed up in your practice for clients to see as well. And I think, again, it comes back to developing their confidence with knowing that you're following strict procedures and you've actually thought about all the things that need to be put in place.
Yeah, no, it's quite comprehensive, that's for sure. And I think you don't really realize how detailed you need to be with this when you just kind of thinking, oh, what do I need? And I think a lot of people, when they get the pack, will see that they would not have thought to include those things, or they would have maybe just had one sheet. So you've got the kit that you can buy, but I see it also says there's also a free resources section on your website. Can you tell me a bit about that as well?
So the free resources section is really, again, about having all the information that you need in one place, because I think that the challenge is that there's a lot of information and it's quite difficult to make sense of it all. So we have included there links to government sites that specifically outline what the government regulations are. And we've also included information on different suppliers of PPE, and we've contacted all of the suppliers. We are confident that they're able to provide a service. So it's just really about making that information accessible. We also have infographics, so things that you can print out and put in your practice. So things about social distancing, information on hand washing. And I really think, it's about us realizing that, and through the process of our own private practice, as you say, Tasneem, it is incredibly, incredibly time consuming. And we realize that actually, if we invest time, the four of us, in developing something that can save time for our colleagues, then we've contributed in the current COVID-19 pandemic. So I think that's where it really came from.
So if you can save time and get back into your practice as quickly as possible, we know how devastating this was for many private practice owners who couldn't practice under level 5. Some could start opening in level 4, but it's only now in level 3 that you can start opening. And a lot of parents are so anxious about their children going back to school and things like that. So you need to make sure that you can alleviate any other further stress or anxiety they have by showing that you are professional and ready and willing to accept them as safely as possible.
Absolutely, Tasneem. And I think, we've actually, amongst the four of us and also with other colleagues, there have been a couple of scares, where people have been exposed to COVID, or there has been someone who was tested positive in your own workplace. And to actually be able to say, well, all my documentation is in check, I've followed all the protocols, knowing that you've, even though there maybe potentially was some exposure to someone who is COVID positive, which can happen at the shops, it can happen anywhere. We must be realistic that these things are going to happen. But to know that you've had strict protocols that has significantly reduced any kind of risk of transmission, I think is really good. And we know that transmission risk is low if you've maintained, the 1.5 to 2 meter distance, if you've both been wearing masks, if you haven't had close physical contact, if there's good ventilation. There are a number of things that we can really practically put in place to reduce risk for ourselves and our clients.
Yeah, and I think what is also important to remember that as health professionals, one of the things that is really critical for all health professionals across the board is documentation, whether that's in your treatment plans, in your assessments, in everything you do needs to be documented. And having something like this just makes that documentation so much easier from an ethical standpoint, but also from a legal standpoint. That is actually a requirement of us as health professionals to document everything.
Yes, absolutely. We've also got a Facebook page, and we have uploaded a couple of videos, one specifically on how to use hand sanitizer correctly, and also how to wear a mask and a face shield, because I think that's again really helpful and practical to know how to do that effectively.
And these videos are on your Facebook page?
Yes, on Facebook, yes. We also really wanting to connect with other healthcare professionals, and we've actually started to offer a sort of free 10-minute consultation for anyone who just wants to know a bit more about what we're doing, but also maybe needs a little bit of guidance in terms of where to go and what PPE do I need, or should I be actually getting these protocol guidelines? What is the best thing for me? So when somebody does choose to get one of the COVID care plans, we actually can very much have a discussion thereafter, and we might decide actually someone receives it and they've got a couple of questions, or they want to know something specific about their own practice. We're just on the other end of the phone. So it's really about us also being there as consultants to ask for advice, a person to be able to discuss something with. And I think, the four of us are all working individually in our practices. We're all working on our own, and I think that's where we realize there's really a need to be talking more about this. There's a need for resources. There's a need to simplify this, because it's just it all seems quite big and scary. So yeah, I think that that's also something we really want to be able to offer our colleagues, is just a conversation. We've done a lot of research, we spent a lot of time, so we want to be able to share that with others. Yeah.
Yeah, and I also see on your website under your free downloads, you've got the client permit to travel for appointment, which is what you mentioned earlier, which is in the care plan as well. But if somebody wants to just get that, they can. You've got the employee permit. So if you've got your reception staff, your cleaning staff, whoever works in your practice, and then you've got this monitoring and management of essential worker for COVID-19 related infections. Tell me a bit about that one. I'm not sure what that one is about.
So that one is actually specifically around what to do if you develop COVID, or if one of your colleagues develops COVID, and how to deal with that situation. You know, obviously you've got to do contact tracing and make sure that everyone is informed that has been in contact with you, but there are also protocols for making sure that the area is sanitized. You've got to notify people. So we actually more recently added that as a resource after an experience where someone was tested positive, and it was that frantic moment of, well, what do we do now? And we just realized that, you know, we're doing all of these things to prevent this from happening. But
what if it actually does happen?
She does happen. So yeah, that's where that really comes in. So just getting some guidance on how do we manage this if one of our clients or ourselves or a colleague does test positive.
No, that's excellent. Well, thank you so much for your time and for explaining all of this, and for this fantastic resource that you've provided. Are there any, from just purely from as a health professional in private practice, do you have any last advice, whether it's to do with planning, you know, preparing to be COVID ready, or just general advice for private practice owners out there, advice or an encouragement before you go?
So I think that my biggest piece of advice is that we do need to care for ourselves and look after ourselves before we start putting our attention on caring for others. And I think that is especially true in this time of the pandemic. You know, with the work that I've been doing in the hospital, there's a very strong sense of, if someone needs urgent attention, the first thing you need to do, and if that patient is COVID positive, the first thing you need to do is put on your PPE, make sure you've got your N95 mask and your gloves and everything that you need to protect yourself before you can help that person. And that is as healthcare professionals, that can be quite a hard thing to get our head around. We tend to go into the healthcare industry because we may be quite selfless people. We want to help others and we want to give to others. But I think in this time, we need to be looking after ourselves, taking care of our own mental and physical health, and protecting ourselves from the virus just as much as we are protecting our clients. So I think that would be my biggest piece of advice.
Thank you so much once again.